If you're signing up for Medicare this year or wondering if you should sign up for Medicare, this video is for you. I've been helping people sign up for Medicare for the last 15 years. And right now, my company helps 1,000 people every month set up their Medicare benefits. And in this video, I'm going to share with you the 6 most common mistakes that we see people make all the time, and I don't want you to make any of them. Hey there, I'm Marvin Music, and on this channel, our goal is to provide the best Medicare education possible so that you can avoid making the worst Medicare mistakes. So if you're new to our community, feel free to hit the subscribe button so that every time we post a new video, you'll be notified. Also, we know Medicare is complicated, so down below this video in the description, you will see some places that you can go to get more help. Feel free to check those out at any time. Folks, I'm almost 62 years old, which means I'm going to start Medicare in 3 years. And these are the mistakes that I know I would want someone to tell me about so I wouldn't be penalized or find myself in a situation without coverage. Mistake number 1, thinking you'll be penalized if you don't sign up for Medicare at 65. Now, it is true there are some of you that will have to start Medicare at 65. In fact, if you're presently covered by a retiree plan of you or your spouses, you will have to start Medicare at 65. If you're covered by COBRA insurance, you'll start at 65. If you're on Affordable Care Act plan, which means you went through the healthcare exchange to set up an individual policy, you're going to start Medicare at 65. And then if you or your spouse are still working and you're covered by a group plan of 19 insureds or less, you will start Medicare at 65. So there are people that will start Medicare at 65, and if they don't, they will be penalized. Those that are on retiree plans, ACA plans, COBRA plans, or small group plans must start Medicare at 65. But others of you, you're still working or your spouse is working, and you're covered by an employer-provided plan that has 20 insureds or more in that. You don't have to do anything with Medicare. You don't have to enroll in A, and you don't have to enroll into Part B. Now, if you enroll into Part A, it may be a fine decision, but if you're contributing to a health savings account, an HSA, you need to really think that through before you enroll into Part A, because you can no longer put money into your HSA if you take any form of Medicare. So some will be penalized, but some will not. And really, when you think about it logically, if you're in a large group plan of 20 or more, Medicare is glad that you're not going on Medicare because they're not responsible for you. And they will allow you to come into Medicare at a future date when you lose the employer-provided plan. So to dispel the myth that you have to sign up for Medicare at 65, I hope now you realize you don't have to. If you're in a large group of 20 or more, you will not be penalized if you don't go on Medicare at 65. Mistake number 2, staying on employer coverage when Medicare is a better option. Now, I just explained that some of you are covered by work plans of 20 or more insureds in the group. That could be your plan or your spouse's plan. And again, you don't have to do anything with Medicare. And some of you have very good group plans, which means you have a very low premium, you have a low deductible. If you got something serious like cancer, you have a very low max out of pocket. And those plans are wonderful for you, and you need to stay on those plans, especially if you have a spouse or children that are covered by those plans. But others of you, your group plans are not very good. You're paying a high premium for them, they have a high deductible, probably a very high max out of pocket if something seriously happened to you. And in that situation, it may be a very good option for you to look at Medicare. And all you need to do is look at the premium and the deductible and the max out of pocket and the medications. And with that information, you can make a decision whether Medicare makes sense or not. And sometimes it does make financial sense to go on Medicare while you're still working. You can do that at 65, or you can usually do that anytime that your employer is going through the open enrollment period. And so some of you do need to go on Medicare while you're still working. Now, a good rule of thumb for making this decision is if your premium is costing you more than $250 a month, if you have a deductible above $1,500 and you have a max out of pocket that's $5,000 or higher than that, then you need to look at Medicare seriously. Mistake number 3, not understanding the 4 major differences between Advantage plans and supplemental plans. Now, folks, there's a lot of companies out there that will have multiple plans and multiple options. But when we go on Medicare, it really all boils down that you have 2 choices. These are 2 systems and 2 possible ways that you will use your Medicare benefits. One is to use an Advantage plan. The other is to stay in original Medicare with the supplemental plan. And so these 2 systems are available to you, and there are differences between them. I want to talk about those differences. Number 1, if you take an Advantage plan, you will be on a network plan. You have to choose with the Advantage plan either an HMO or a PPO. Now, if you choose to stay in original Medicare A and B with a supplemental plan, there are no networks. The only thing you have to make sure is that the provider you want to go to, the doctor or the hospital you want to go to, takes Medicare. So there are no networks with original Medicare and a supplemental plan, only with Advantage plans. The second difference between these systems will be one is a copay-based system and one is more premium-based. And so if you decide to take an Advantage plan, you pay copays. Now it is true there are a few services where there's a zero copay. You can usually see your primary care doctor for zero. Preventive will be zero. There will be a gym membership in there for zero. So there's a few things that are zero. But for most of the services you get on an Advantage plan, you're going to pay at copays. If you go to the hospital, it will not be zero. It's probably going to cost you $350 a day. If you have an outpatient procedure or an outpatient surgery, it probably costs you $300 or $400 copay. If you see a specialist, it'll cost you $50 copay. So in the Advantage system, we pay copays for the healthcare services that we need. It is true we don't have a premium that we will have to pay the insurance company, but we're going to pay copays instead of premiums. Now, if we take a supplemental plan, there are very little copays or very little out-of-pocket expense because what you're doing is you're paying a premium to that supplemental company. So you've taken the risk of your copays and your deductibles and all that, and you transferred that to an insurance company, and you have to pay them a premium to take the risk. So either system we're going to pay out of pocket. Either we pay a premium and we're pretty well done, or we pay copays for all the services that we're going to need. The third difference between these systems will be pre-authorizations. If you decide to take an Advantage plan, about 70% of the services that you're going to need will require the insurance company's final approval. Now, you don't have to have a pre-authorization to see a primary care doctor or get a prescription or see a specialist. But if you're going to have a CAT scan or an outpatient procedure or need to go to a skilled nursing facility or to a hospital, those things have to be pre-approved by the insurance company, which means if you need, let's just say, hip replacement, the doctor says you need it, but the insurance company also has to agree with what the doctor's decision is. So truly, the insurance company has a final authority in a lot of the services that you're going to need. Now, as we compare that to a supplemental plan, if the doctor says you need something and Medicare says they'll cover it, the insurance company has no say-so whatsoever. We don't have to have a pre-authorization if we get a supplemental plan. So when you make a decision as to how you're going to use your Medicare benefits, whether that's Advantage plans or a supplemental plan, pre-authorizations are going to be a factor in that decision. The fourth major difference between Advantage plans and supplemental plans will be the length of the plan or the term of the plan. When you buy an Advantage plan, it is a calendar year plan. And it's basically an agreement between Medicare, the insurance company, and you. And so the insurance company has to be true to the terms of that plan for that year. But the following year, they can change whatever they want to change. They can raise the deductible. They can change the max out of pocket. They can actually pull the plan. So those are plans that are written for 1 year at a time. And that's why Medicare has the opportunity every year for people to change those plans if they need to. So Advantage plans are annual plans. As we compare that to supplemental plans are written for life. Just like Medicare A and B is for life, so will that supplemental plan be. All you have to do is pay your premium, and that company cannot change the terms of your coverage. And so when you make a decision as to what system you're going to use, you got to realize if I take an Advantage plan, there will be some maintenance that will be required. You have to make sure you're on the right plan every year, and sometimes those are going to need to be switched. If we take a supplemental plan, the only thing you have to do is pay your premium, and you actually will have that policy then for life. So when you decide to sign up for Medicare, you're going to have to choose one of these two systems and using those benefits. As you can see, they're totally different, and you don't want to make a mistake with this choice. Mistake number 4, missing the once-in-a-lifetime opportunity to sign up for a Medigap policy. Many people make the mistake of thinking that once they go on Medicare and if they choose a plan and they're no longer happy with the plan, they can just easily, anytime they would like, get off the plan and make a switch. And folks, that is not true. In fact, one of the biggest mistakes that people make is they'll take an Advantage plan and they're going to plan to be on that Advantage plan for maybe 2, 3, 4, 5 years, and then they're going to get off the plan and get a supplemental plan. And their thinking is, I'll save the money for a while, then once my health changes, then I can move to a Medigap policy. And that is not true. And the reason for that is because you can actually buy a Medicare supplemental policy, a Medigap policy, during the first 6 months of going on Medicare with no health questions asked whatsoever. Meaning once you start Medicare, we have this period of time called the Medigap open enrollment period. And during that period of time, the insurance company cannot ask you any health questions. And if you have any pre-existing conditions, they have to write the policy for you. But again, it's only limited in most states to 6 months. And so if my health were to change after 6 months, if I want to get on a Medigap policy, now I have to go through medical underwriting. And so this once-in-a-lifetime opportunity, insurance company has to take you, but after that they don't. We're going to have to ask you 25 or 30 health questions to make the switch. We're going to have to check your medications to make that switch and probably get a statement from your doctor. And so if you have any health issues going on that are kind of minor to major issues, that insurance company has the right to say, no, we're not going to issue that policy. So this once-in-a-lifetime opportunity is important for everyone, but especially those of you that have health issues, because this could be your only time to get that Medigap policy. Before we get into this next mistake, which relates to prescription drug coverage, if you're finding this video helpful, please hit the subscribe button, and if you ring the bell, you'll be guaranteed to get a notification when we post a new educational video. Mistake number 5, not signing up for a drug plan when you first go on Medicare because your meds are cheap. We help lots of people set up their Medicare benefits, and there's not a day that goes by that we do not have people say to us, hey, I would rather pay cash for my drugs. I can use GoodRx coupons. Why would I pay a premium for a prescription drug plan when I can get my meds cheaper through cash or through a coupon? And folks, the problem with that mindset is that you're looking at the medications that you're taking right now. Sure, they may be cheap. They may be generic medications. But you have to be aware of that your medications could change because your health could change very rapidly. Just recently, I had a lady that had Crohn's disease, and her medication was $23,000 a month. I had a guy recently who said he's on a medication that saves his life, and it costs $16,000 a month. People who are on self-administered chemotherapy pills, those medications cost $7,000 a month. Sure, the meds you're taking right now may be very inexpensive, but you may need something that's expensive, and that's why we get a drug plan, not for what we're taking now, but for something we'll need in the future. Because if you don't take a drug plan when you're first eligible, right, when you're starting Medicare, you can get one at a later date, but you will be penalized. And the worst thing that can happen is if you need an expensive medication and you're in the middle of a year where you cannot add a drug plan, and then you'll have to pay full cost for those medications until you can add that drug plan. And so that's why you always want to take a drug plan when you're first signing up for Medicare to avoid the penalties, but also avoid being without coverage. Mistake number 6, thinking you will save money trying to sign up for everything by yourself. Now, I want you to know I'm kind of a do-it-yourself guy. I enjoy figuring things out, and usually when I do it yourself, I'm going to save some money. But when it comes to Medicare, if you try to do this alone, it's very possible that you can make a huge mistake. And secondly, you're not going to save any money. Because you can actually go directly to an insurance company and do an enrollment, and you're still going to pay the same price as if you got assistance from someone who can walk you through this entire process. So again, you cannot save money doing it yourself. In fact, you could cost yourself drastically. I had a gentleman recently that actually went on Medicare too early. He should have stayed on his group plan. And now he's ready for retirement, and now because his health is poor, he has minimal options, and it's going to cost him about $30,000 out of pocket because he went on Medicare too early. I've seen multiple people go on Medicare too late. In other words, they tried to do this themselves and they made decisions. They didn't understand what they were doing, went on Medicare too late, and had a lady who cost herself $80,000. Now, those are extreme cases, but it's not uncommon for people to try to do this themselves, make a mistake, and it costs them several $100s, if not a few $1,000s. And so you cannot save money by doing this alone. Now, when you do get help, there's actually 2 ways in which you can get help. You can get help through what is called a captive agent, or you can get one through an independent broker. Now, a captive agent means that this is an agent who works for one company. They represent one company and only one company, and the limited portfolio that company has for products for you. Now, an independent broker, what they're going to do is they're going to have multiple options. Usually they're very knowledgeable, have a lot of experience, but they have options, and most importantly, they're going to be unbiased. Because they're a broker, they can look at all the different options you have and give you advice that's going to be best for you, not best for the company. All right, and so either way you go, the price is going to be all the same. So when it comes to doing it yourself, you're not going to save any money. You could really cost yourself a lot. You know, if I have a bad tooth, I have the option. I can try to figure out and pull that tooth myself. And if I do so, it's probably not going to go so well. And so I could do it wrongly. I could have infection because of that. I could create a lot of problems down the road. And so what am I going to do? I'm going to go to a dentist because they know how to do it. They've got a lot of experience and it's going to be done right. And there's going to be no complications if I get professional help getting the tooth pulled. And really the same thing is true with Medicare. So in wrapping up this mistake, you cannot save money by doing it yourself. Either you can use a captive agent, limited options, or you can use an independent broker where you'll look at all the options available in your market. So as you can see, these are huge mistakes that I don't want you to make. Number one, will you be penalized if you don't take Medicare at 65? Yes, you will. If you're covered by a retiree plan, COBRA plan, ACA plan, or a small group of 19 or less. But if you're in a group of 20 or more, you or your spouse still working, you will not be penalized if you don't take Medicare A or B. Number two, should you completely ignore Medicare if you have group coverage available? Well, maybe if your group coverage is a very low premium, again, low deductible, low max out of pocket, you probably want to ignore Medicare, especially if you have a younger spouse or children on your plan and they would be impacted by that decision. But if your group plan is not so good, you're paying $200, $250 or more a month, it has a high deductible, high max out of pocket, then Medicare may make sense for you. And so make a comparison between your group plan and your Medicare option. And you can do this every year during your company's open enrollment period. Number three, do you understand the four major differences between Advantage plans and supplemental plans? Advantage plans have networks, supplemental plans do not. Advantage plans have HMOs and PPOs, supplemental plans you can go to anywhere that takes Medicare. Both options are going to have out-of-pocket expenses. Advantage plans, you're going to pay as you go for the services that you need for your health care. With supplemental plans, you simply pay a premium and you're pretty well done with out-of-pocket expenses. Remember that with Advantage plans, we're going to have about 70% of the services that have to be pre-approved by the insurance company before you get that service. With supplemental plans, there's no pre-authorizations. If the doctor says you need it, Medicare covers it, end of story. Advantage plans are written for only 1 year at a time. They can be switched during the Medicare open enrollment period. Supplemental plans are written for life. So make sure you understand these differences so you do not sign up for the wrong plan. Number four, do you realize the importance of this once-in-a-lifetime opportunity to buy a Medicare supplemental policy? Once you've gone on Medicare fully A and B, remember you have 6 months where that insurance company cannot ask you any health questions. They absolutely have to issue that policy regardless of any pre-existing conditions or any health problem that you have. So it's very important to make that decision during that 6-month period. Number five, should you get a drug plan when you first go on Medicare, even if you only take cheap medications? Absolutely, yes, you should. Why? Because you can't look at the meds I'm taking now. I've got to make sure that if I need something expensive in the future, I'm going to have that covered by a drug plan. Number six, can you save yourself any money if you try to navigate through all this Medicare alone? No, you can't. In fact, you could cost yourself lots and lots of money if you make any kind of a poor decision. And so you want to get help, just be sure you get help from the right person. We're always looking to provide you all the education that you need. So please do me a favor. Write in the comments what is the most confusing part of Medicare for you, and we'll do our very best to break it down for you easily in an upcoming video. Thanks for watching this video. Subscribe and ring the bell for more content just like this. If you want to continue learning about Medicare, feel free to click or tap on one of these other videos. This channel is all about helping you avoid Medicare mistakes. And as always, I wish you the best on your journey to or through retirement. Talk to you soon.